So, could this be a way of dealing with clicky knees or really uncomfortable knees? So, if you kneel and it feels like you're really kneeling and it's really sharp pain on the corner of your knee here, it probably means your kneecap's sitting up a bit high. And your kneecap is a very fluid joint within a capsule, and it glides and slides side to side, around and up and down, and it creates mechanical advantage, but also enables the knee to be spiral in and spiral out of its lock in position when it's straight and unlock when it's bent. So sometimes the knee gets quite stuck in a high position, and these exercises are a really good way of releasing it. Just to see how released, how tight, how loose your knee is, just have the foot on a flat surface, heel drop down a little bit lower, and you should be able to move the kneecap side to side. You should just feel like you've got this kind of little wobble going on. And that ease, that fluidity of movement side to side should be replicated in the up and down movement. So you should be able to feel you can pull the knee up and down a little bit. Now, I know I've been running a lot this week, so it all gets a bit tight sometimes and sore when it gets overtired. So I'm going to release that because that's not moving enough up and down in this position. I want it to be a bit freer. So going to kind of find the edge of the fascial collar which sits around the kneecap. And if I just follow from the top of the knee and draw it back towards my thigh, there's just about there I can feel a little ridge of tissue. And at that point there's a muscle that sits and pulls the kneecap into its extended, in its upright position, its elevated position. I'm going to put both thumbs around the thigh and wrap my hands around my thigh muscles. And then I'm going to turn my thigh muscle left and right around the bone of the leg. And do that, 10, 12 times. And I'm quite firm. I'm not bruising, but it's quite vigorous. And then I'm going to maybe keep the leg still and move the bones inside the leg. So just kind of getting that to work for both directions. Now immediately I don't know if you can see it, but it feels much more free. And I've basically released what I call the articularis, which is a muscle here, which kind of gets quite concertina, quite compressed. And when it's compressed, it pulls the knee up into space. Now, the other thing that sometimes happens is that the medial muscle of the leg bone, the leg doesn't quite fire up as soon as the big quad on the outside edge. And so the kneecap tends to glide in not the most optimal position. So I'm just going to see and feel how that feels. So I'm going to put two fingers from the opposite hand onto the inside of the knee. And if I pull the kneecap up with my thigh muscles, it should glide against the fingertips rather than pulling wider. And ideally, it's doing a little bit, but can you see it's just slightly giving up, and then this fires up too late. So I want this to activate a little bit sooner. So I'm just going to do some taps. They're quite vigorous. And as I'm doing this, I'm just really waking up the nerve path to the muscle. And then now I've got more of a straight line pull. And can you see how, if you can see, this muscle is now firing as the same time as this muscle here. So it's just reorganizing it. So now I've got this is what pulls the kneecap up muscle working. And then as I let it go, the kneecap can descend. And that means now that instead of maybe kneeling on the very sharp corner of the kneecap itself, if I bend my knee slides around and out of the way, I can actually be on a different point and a bit more comfortable. So hope that makes some sense. Give it a go. You might find that your knees then stop clicking so much more happy kneeling, and all working out well. Thank you.